All right, let's get started, you guys. So tonight, we are going to be talking about conditions of the respiratory system. So I like to start out with a little review of the respiratory system and the major parts of the respiratory system, major functions. And when we think of the respiratory system, number one function is always going to be gas exchange. It is exchanging the old carbon dioxide for fresh, shiny new oxygen, but it also functions in phonation, which is making speech sounds, because you can't really talk without lungs. You know, funny how that works out. Just a few little anatomy points here on the slide, nothing super important for us, just a really cool screenshot from my anatomy app. All right, so in review of the anatomy, we'll start with the upper respiratory tract. This will include things like nose, as well as your nasal conchae. Are you guys familiar with the nasal conchae? Anybody unfamiliar with the nasal conchae? Raise your hand. All right, nasal conchae are bones that sit inside the nose, and they have little projections that stick out into the nasal canal with these kind of like spiral shaped projections. And the idea is, as you breathe in air, because the walls of the chamber become spiraled, then the air starts to circulate. The act of circulating the air throws dust particles off to the sides, and they get stuck on the mucous membranes. So it's a way of kind of cleaning and filtering the air, as well as kind of warming the air a little bit before it enters the lungs. You ever gone running on a really cold day and how like burning your lungs get? That is because the air did not get warmed first. So that is what the nasal conchae do. We also have sinuses. So sinuses are going to be empty pockets found within bone. They are lined with epithelial tissue. Usually that is going to be mucus producing epithelial tissue. So you've got a mucus layer on the inside wall of this flesh bubble found inside your bones. There are 4 primary sinuses, and they are named after the bone within which they are found. So we'll start with the frontal sinus. You'll see on the picture here, it's the pink triangular looking portion right there. It is a hollow space within the frontal bone. The maxillary sinus sits within the maxilla. The sphenoid sinus sits behind your eyeballs, and the ethmoid sinus sits between your eyeballs. So you ever get those sinus pressure where it feels like your eyeballs are being pushed out of their sockets? That is probably the sphenoid sinus. It's that big pink bubble, kind of posterior and inferior to the eyeballs here on your slide. And then last we have the mouth. And the mouth is, you know, the mouth. Now the lower respiratory tract is after we cross the kind of invisible dotted line right about there. So once we leave the mouth and we start entering the neck, now we are entering the upper respiratory tract. We have the pharynx, which again is your throat, this little part of your throat back here that you hawk loogies through. The trachea, which is the windpipe, that is the single main branch on the illustration you see there. The epiglottis is a fancy little flap that separates the division where you either head into the lungs or you head down into the stomach. And so there's a little flap that sits on either side. Normally, it stays closed for the stomach, so the airway remains open. It closes the airway when you swallow, so it'll flip open, the food goes down to the stomach, and then the glottis opens again. You ever had like food go down the wrong pipe? That's usually what happens. The food got stuck on the glottis as it tried to open or close, and you just kind of got to cough and get the thing lodged away. Happens all the time. The larynx is your voice box. So that is like the top portion there of the illustration. That part sits right about here. There's your little voice box. The bronchi are the 2 main branches off of the trachea. So you have 2 bronchi, and then they will branch into smaller bronchioles. And the very tips of the bronchioles are tipped by alveoli. So alveoli are super fancy little structures. They are made of squamous epithelial tissue, which means the cells are flat like a pancake. So you have a bunch of these little flat cells that line up like this. So they form a very, very thin membrane. And this is the membrane through which gas exchange occurs. Now you'll notice if you look in that illustration, the walls of the alveoli have little holes in them. So all these little chambers are connected to each other. And the idea is they work kind of like a cluster of balloons. So as air is pulled into the lungs, they swell and inflate. This brings the air into close contact with the blood vessels, separated only by that membrane of the alveoli. And if we remember back from like biology 101, nature hates gradients, and will do whatever it can to level out concentrations of things. So you set up a concentration gradient within the alveoli where the alveoli has a lot of oxygen and not a lot of carbon dioxide. But across the membrane in the blood, we have a lot of carbon dioxide, but not a lot of oxygen. And so diffusion will occur. Diffusion will naturally occur across this membrane. So the oxygen and the carbon dioxide start to swap places until they're just about balanced. And then we exhale. So I hope that was a nice little review. As we move into respiratory disorders, respiratory problems are caused by any number of things. Some of the more common causes would be infection. Remember, guys, any place where the inside of the body is exposed to the outside of the body is going to be prone to infection. So if you think about something like a cut on the skin, right? That's why we treat cuts in that and such, because they're so prone to infection. But there are other areas where the inside of the body is exposed to the outside, and we tend to get a lot of infections there. Ear, nose, throat, right? As well as urinary tract infections, yeast infections, right? All those kinds of parts where the outside is, or the inside is exposed to the outside. So infection, super common. Also inherited disorders. Also lack of mobility. A lot of things in the body depend on movement, right? We've talked about venous blood return. We've talked about lymphatic system. All of these require the body to move in order to function properly. Lungs are no different. Lungs themselves cannot move. Lungs alone can do nothing. They require muscles to contract, to lift the rib cage, to drop the diaphragm, to create a negative air pressure, which will pull air into the lungs. Without muscles, we can't breathe. Lungs do not do that by themselves, right? They can process the air, but they can't bring air in or push air out. So if we are unable to move, then lungs can develop issues, whether this is caused by paralysis or what have you. And then we can't talk about lung issues without talking about smoking. Smoking has caused lots of different kinds of lung diseases, lung cancer, emphysema, COPD. So other conditions that people can develop, so things like asthma and bronchitis, these can lead to respiratory problems. Sometimes those problems are severe. Symptoms of these things will naturally include difficulty breathing. So anything with the lungs, you just kind of tack that symptom on there. They're gonna have problems breathing. They may develop congestion in the lungs, where some of those alveoli are full of fluid instead of air. And since the lungs, kind of their whole function is processing air, if they are full of fluid, then they cannot do their jobs. And so they cannot produce oxygen for the blood, and that causes all kinds of chain reactions down the line as muscle and organs start to starve for oxygen. That will also usually lead to chest pain as well. Generally, to treat respiratory illnesses, they prescribe various medications. These could be mucolytics to break up mucus congestion. These could be or inhalation therapies. You guys are probably most familiar with like albuterol, like the asthma inhaler type deal. But other types can be put on other kinds of breathing treatments. Have you guys ever seen a nebulizer before? The little machine with like the big mask you got to wear over your face. So lucky for us, we do not have to prescribe anything or tell anyone how to use nebulizers. That is wholly outside our scope of practice. Which begs the question, what is in our scope of practice? What is our usual treatment plan? What are our treatment objectives when working with a client who has some kind of respiratory condition? Well, I'm glad you asked. Generally, we would apply massage to the chest or to the abdomen or to the back. We could also include massage to the diaphragms. Let me move my camera. You can apply massage to the diaphragm. You got to get under the ribs and focus on the diaphragm in there, or the intercostal muscles. You place your fingers in between the ribs and you dig in and start loosening up the intercostal muscles. In particular with those, you want to focus on the upper intercostal muscles because those tend to be the ones that are more overused. People tend to be shallow chest breathers rather than full deep belly breathers. So it tends to be the upper ribs that start to lose movement. Yeah, I think that's all I want to say about that. Techniques. Any kind of good, like gentle effleurage that will encourage circulation, particularly strokes like deep friction strokes using the fingertips, again, lined in between the ribs to really target the intercostal muscles. And another one is tapotement. Now, I don't know exactly how. I'm going to get this sentence together. I promise. It's coming. I have not taught massage fundamentals. There we go. So I do not know if you guys are taught all the different types of tapotement. That would be a question.
I think they went through like 6 different types.
That sounds about right. So we start with like tapping, which is usually done on the face. And then you have slapping, which is usually done on like more broader areas like legs and thighs and backs, right? Slapping with a flat palm. And then we have cupping, done with a cupped palm. And then you have hacking, done with the edge of the hands, right? Your traditional Swedish massage Helga move. And then beating with loose fists. I think that about covers all the major ones. The one of most importance to us today is cupping. And you want to listen for that distinctive kind of hollow sound when you're doing it right. Got a nice hollow kind of echoey sound to it. It should not sound like a slap. It should sound hollow. I don't know if you guys could hear the difference, but try it on yourself. It's a fun time. Cupping tapotement is used all the time by respiratory therapists and physical therapists that are treating respiratory conditions. They use this technique all the time because it is really, really effective at breaking up phlegm congestion. And so then once it's broken up, then they can cough it out. The issue is it's stuck deep down in the lung. So the cupping technique helps breaks it up and the lung will start kind of moving it upwards, and then coughing will take over and they will expel the sputum is the technical phrase, but they'll hack it up. But if they are actively undergoing some kind of real serious respiratory illness, I would like a thumbs up from a physician, just a doctor's note saying yes or no, or only do this kind of massage. They'll let you know. They will tell you specifically what you can and can't do. Good stuff so far? Cool. So, benefits of massage for respiratory illnesses. Well, it encourages deeper breathing. And I don't really think we have to think too hard about that, right? Why would it encourage deeper breathing? Well, we are calming the nervous system, activating the parasympathetic division. We can also loosen the intercostal muscles, which allows the rib cage to expand more, which allows them to breathe more deeply. Massage also lowers blood pressure. And again, since the lungs are full of blood, right, all those little tiny blood vessels wrapped around the alveoli, when blood pressure is up, the alveoli get slightly squeezed. It is slight, guys. It is a slight squeeze. But when 700 million alveoli, Samad, when 700 million alveoli per lung are getting a slight squeeze overall, that is a drop in lung capacity. So high blood pressure is a factor. Massage also, as we said, kind of helps move that congestion, so it can help break up and release lung congestion, mucus, sputum, stuff like that. Massage also can generate heat in the body, generally with frictioning strokes, but we can generate heat, which raises body temperature, which raises the respiratory rate. So they breathe more breaths per minute and thereby get more oxygen. So we increase their breathing rate, we increase their breathing depth, therefore letting them get more oxygen, and then the relaxation of massage encourages them to breathe even more deeply. So we do have something to offer. Now, granted, there's nothing we can do for the condition itself, right? All we're really doing is kind of treating symptoms and just kind of like easing quality of life, things like that. But that, as caregivers, that is what we are called on to do as massage therapists. So now we're going to start getting into some of the more specific conditions. And if we're talking about a respiratory condition, we're going to start with the common cold, right? We got to start with there. Common colds move very frequently from person to person through contaminated objects. So you got to wash your hands frequently. This is spreads very easily, runs through offices. It will run through a spa for sure. So avoid touching your mucous membranes. Don't touch your mouth, don't touch your nose. Wash your hands after you go to the bathroom, that kind of stuff. Now, the cold and flu are often, sometimes they kind of use the words interchangeably, like, oh, it's a cold or flu, same thing. Cold and flus, guys, not the same thing. Not the same thing. Colds are much milder. They are self-resolving, so they usually resolve themselves after a few days, usually 2 to 4 days. Colds do not become epidemic. You don't get long-term complications. People aren't usually hospitalized for colds. And the cold isn't airborne. It's on surfaces. It's things that you've touched and then touched your mouth or your eyes or your nose and then went and touched other stuff. So one of the reasons why the cold isn't such one of the reasons why the flu is worse than the cold is, yes, the flu mutates, and which is why you got to get a new flu shot every year. The common cold mutates so readily, so quickly, that its best survival strategy is not to kill its host. If it wants to survive and then keep mutating, its strategy is to stay not super deadly, but really contagious. So you guys ever played Pandemic before, the game? It's a solid strategy, man. If you're trying to infect the world, don't kill everyone right off the bat. You know what I'm saying? Mild symptoms are the way to go. You get spread far and wide, because once Madagascar closes its borders, man, game over. That's it. If you guys haven't played the game Pandemic, you are the virus and you're trying to infect the world. And Madagascar, being an island, when they close their borders, you cannot infect Madagascar and you can't win the game. And it's really frustrating. Okay, so common cold. As we said, very infectious. However, after the infection subsides and they are no longer like all cold-headed, massage can help. We can help kind of get some fluids moving, try to help ease some of that congestion. But you do want to be cautious, because any recovery period can be made worse by massage. We can prolong the recovery period instead of shortening it. You just want to pay attention. You just want to pay attention. You really want to make sure that they are over the infection and truly on the road to recovery. because if they're still fighting the infection and you give them a massage, you could prolong the infection. Incidentally, colds are caused by a virus. It is a rhinovirus, which is in the family of coronaviruses. Yes, that coronavirus, except the coronavirus and colds are like third cousins, right? They have like great grandparents in common. They're related to each other. They're in the same family of viruses, but the novel coronavirus is novel, meaning it is new. It is a new kid on the block. So the coronavirus is the one special one that we've all been talking about for a year and a half, but coronaviruses are just a family of viruses. That's it. Common colds belong there too. Now, influenza, on the other hand, influenza is airborne. So you just have to be in the same room with someone with the flu and you can contract the flu. The flu is also a virus which will infect the mucus producing cells in your upper respiratory tract. So in your nose, down your throat. The danger here with the flu is that because you're sick, you're in a weakened state, and then you have a secondary bacterial infection in the area that has been compromised, upper respiratory, right? This is where the infection is. And again, this is where you're most likely to get infections because you're opened up to the outside world. So once you're already infected and you're already weakened, then you get pneumonia. And that's how it goes. Or bronchitis, or one of the other conditions. Pneumonia is pretty common though. But differences from the common cold, guys. Influenza, you have a much higher fever, usually of about 102, 103, and it lasts for a few days. You are extremely fatigued, like you feel really, really sick. The medical word for, that feeling when you're really sick and you're just tired and you just want to lay on the couch and you don't have energy to like get up and do anything? That is malaise. Malaise. That is usually one of the symptoms of the flu: extreme fatigue and malaise. Muscle and joint pain. So like the flu hurts, you ache. If it gets into the lower respiratory system, you could have complications there, like pneumonia and other secondary infections. Even once you have gotten over the symptoms, the flu can still stay contagious for days after you start feeling better. But good news, we have a vaccination for it. So get your flu shots. The flu, probably shouldn't have to say this in my out loud voice, is contraindicated for massage. If they have the flu, they probably won't come to you for massage, because if you've never had a flu before, it's going to take an act of Congress to drag them off the couch. It would if it was me. So you want to make sure that they've been symptom free for at least several days. Better opt for closer to a week before you massage them, just to make sure they're not contagious anymore. The flu is nasty. It is no joke, and it will rip through spas, guys. It will rip through spas if you are not careful. All right, next up, we have acute bronchitis. And this is an acute inflammation of the bronchi, the two main branches off of the trachea. This is usually caused by a contagious viral infection. So as they get infected, they start to swell with, or they start to fill with mucus. And then on top of that, they start to constrict. So it shuts off your airways, makes it harder to breathe. Because it's viral, it is infectious, so it is contagious. So while they have a fever and they have discharge, they're coughing up mucus, do not touch them. They are sick, they have bronchitis, they need to go home. Once the bronchitis has resolved and they are feeling better, they are breathing better, massage is then indicated to help move some fluids around, if you can get them comfortable on the table. But if they still can't lie comfortably, you may be a chair massage. But if they can't lie comfortably, I'd still give them a few more days to recover. And then again, just as a kind of a side note, you guys, we talk about these things, but in the real world, you don't see very many people show up actively having respiratory issues wanting a massage. It's just not. Well, I worked in spas, so it's not usual in the spa. I'll say that. But if you work at a chiropractor office, yeah, maybe not. Maybe I can't say the same if you work for a chiro. Whew. Sinusitis, possibly the funniest medical word there is. Sinusitis is inflammation of the sinuses. Generally, you're looking at frontal or maxillary sinuses, but ethmoid and sphenoid sinuses could absolutely be involved. We described those earlier. Those are the hollow spaces in a bone, generally around the eyes. In turn, they help protect the nose and other areas from dust, allergens, pollutants, because they're coated in a mucous membrane. So if they have a sinus infection and it's acute, it is contraindicated. Any acute infection is always going to be contraindicated. Any fever is always going to be contraindicated. Now, they could have sinusitis that is not contagious. Usually that's an allergy, like a really bad allergy. One of the common ones is hay fever. So you could tell it's allergic because if you look, well, you don't look, that's gross. But like when you look at their mucus, if it's clear and watery, that's normal, that's allergies. But if it's got color to it, like a green or a yellow, the green and the yellow that you are seeing is pus. That is why it is green or yellow. Pus means infection, and that's bad. So do not touch them. Pneumonia. So pneumonia is an infection that causes the alveoli to swell, then become inflamed. They can also fill up with fluid or pus, which causes a lot of symptoms. Again, if they're full of pus, then they are not full of air, so they cannot do their job. This causes symptoms like cough, shocker, fever, infection, so again, not surprising, chills, side effects of fever, and trouble breathing. Wow, none of these symptoms make any sense to me. Pneumonia is rarely the actual issue. It is rarely the primary infection. It is usually a secondary infection after some other primary infection. Often influenza, but could be any number of things. If the client has a compromised immune system, Jesus, it could be almost anything causing the pneumonia. And guys, remember, compromised immune systems are far more common than you may think. It is not just, people with HIV. Anyone who has ever had an organ transplant is going to be on immunosuppressant drugs for the rest of their lives to prevent rejection of the organ. Your body will never accept foreign organs as its own. It will always reject it. You reduce the intensity and the risk of rejection by finding a good match, but even with a good match, you are still on immunosuppressant drugs for your whole life. So your immune system is weakened because you had got a new kidney or a heart or whatever. Lots of other conditions such as cancer, or if not the cancer, then the cancer treatment can cause a reduced immune system. So the list goes on and on.
I have a question actually about transplants.
Yes.
So for the person who is actually transplanting the kidney, is their immune system lower? Or
you mean the donor?
Yeah, the donor. Do they have any problems after that?
Good question. So generally, no. However, it depends on what you donated. So if you donate bone marrow, your immune function could go down a little bit because bone marrow is one of the places that you make immune cells.
Right.
So if you tear down too many of your own police schools, then yeah, you have fewer number of cops, but you will heal. You will produce new bone marrow, your levels will return to normal, but after the donation, you'll have a drop and then it will have to recover, but you will fully recover. Yes, it's the person receiving the organ. Your immune system will never accept some foreign organ, as it will always attack. And do you remember when we talked about with the immune system, we talked about the histocompatibility gene? It's the ID mark. It's like a security badge, like an ID tag that says, I belong to Dave Holden. I am a cell belongs to Dave Holden. Those are individual they are unique to each person, not even twins. have the same, like these are unique, and we cannot use them to like identify people. They are way too small and way too, like, we can't do them, but the immune system is really good at it. But those histocompatibility genes are unique to the individual. They do not change over the course of your life. They do not degrade over the course of your life. So at any point, if you transplant a new organ in, the immune system will not find it, or will not accept it. They will always fight it. We can, the deal with finding a good match is finding a gene that is close enough to yours that the immune system won't launch an all-out war. It will just attack. And you can, so finding a good match lowers the risk of a massive rejection, but you still have to take immunosuppressant drugs. I think I covered it all. I think I said it all there. Good stuff, guys? Cool. Okay, so pneumonia, rarely a primary infection, but so pneumonia itself is not super contagious. You're not likely to catch pneumonia from someone else, but if they have pneumonia, they likely have something else, and that you may catch. So you want to be careful. You want to be careful. Now, if there's under the right conditions, so there is no other acute infection, no fever, nothing like that, then massage is indicated, but you just need to operate within the client's tolerance. They may be sore, they may have trouble breathing, certain positions may be uncomfortable for them, they may not be able to handle a face cradle. Just postural drainage technique is something that we can do. Postural drainage is, I can give you a little segment on this. And if you find this interesting, you should really take a full class on it, because you could take a whole class on this stuff. But here's the basic gist. We talked about how massage therapists can use the cupping technique to break up phlegm. Another thing that you can do to help break up the phlegm is you get a special table that goes on an incline. And so you lay the client down and you're doing your tapotomist on their back, and then you incline the table so that the head is below the lungs, so that you basically turn the lungs upside down and allow gravity to help pull the fluid as you do your little tapotomist stuff on their back. And there's different positioning or positionings that they'll use. So there's like seated positions and then sideline positions and prone, supine, things like that. But the idea is you physically posture the person with gravity assisting you to pull the fluid, and then you manually come in and manipulate the tissue to break up the fluid so that gravity can help pull it out. And when they stand back up, they will like hawk up a softball full of snot. It is disgusting, but it's better for that snot to be in their hand than for it to be in their lungs. So, you know, all right. If that sounded interesting to you, there are whole classes on that stuff you could take if that's your thing.
Would it be possible to use that technique on like a regular hydraulic? You know how some of them like a hydraulic table, how some of them like incline a little bit so you can sit up? Could you just like have them face backwards, or would that not work?
I don't know. Use the hydraulic tables that I've seen don't angle themselves, they just go up and down.
I've seen
esthetician tables, aesthetics tables will have a little bit of an incline to them.
Mm-hmm.
And I've seen those, but those tables are expensive and they are not portable, so you can't take them to people's houses. Those suckers are heavy.
Mm-hmm.
And they're like $1,000, they're like $1,000, like, so you don't.
I know. I have a friend who got
you could just use a chair. You could just use a chair
and incline their feet.
Oh no, not for an incline. I'm saying like sit them down and lean them against the back of the chair.
Oh yeah,
chair massage or something like that. But yeah, they incline at it to a specific amount. It's like, oh God, I can't. 30 degrees, something like that. It's not a lot, but it's about like that. Like it's enough that like they are effectively upside down. Like gravity is pulling the other way on them, but it's not so much that they're, I mean, you don't feel like you're going to fall off the table or anything like that. But again, if people have pneumonia, I mean, the other thing you could do is put them in an inversion table, but that's probably way too much. That's probably way too much. I would not recommend that one. But again, with pneumonia, different positions may be uncomfortable for them. And since they may have some other primary condition, usually want a doctor's note for something like that. Pneumonia is not contagious, but I just want to make sure that we know what we're dealing with. Oh, and in this little picture here, since none of us went to radiology school, I had to look this up to make sure. On this person's left lung, at the top, you see how it's pretty dark black, but down at the bottom, there's like that huge kind of white mass. Most of that mass is the heart. What is suspicious, do I have a little pointer here? Is that and those, that's pneumonia. This black area here is normal. That's what it should look like, but the whole lung should look like that. You should see like clear borders, nice clean borders. So anyway. Tuberculosis. Tuberculosis. Anybody like old Westerns? The old Western movies? And you know, in the old Westerns, there was always that one guy, usually in the saloon, who was like coughing into a handkerchief and he was like coughing up blood. And they would usually say something like, oh, he's got the consumption. They used to call TB consumption. That's what they called it, because it caused you to lose weight so quickly. But consumption or tuberculosis or TB is a very contagious bacterial infection. The name tuberculosis tells you that it is a condition of tubercles, which is what you see here. Those are tubercles. Don't those look like they don't belong there? Yeah, those don't belong there. It starts in the lungs. You get the bacteria in your lungs, and the bacteria can form these little cysts around themselves, which protect them, and it means they live a really long time protected in their little cysts. And they start to create all these little cysts in the lungs. So you start to see symptoms. You start to shortness of breath, coughing fits. Eventually they get worse. You start coughing up blood, sounding familiar. As the tuberculosis spreads, it can spread into other organs and other parts of the body. So you could start to get tubercles in the liver and in the kidneys and in muscles or in the brain or in the spinal cord. And you can see how quickly this gets super, super, super bad. So tuberculosis is treatable. That's the good news. But the bad news is once it crosses a certain point, like once you start getting tubercles throughout the rest of the body, there's really not much we can do. That is third stage tuberculosis, and very few TB patients reach third stage, okay, very few. But of the people that reach third stage, the mortality is 50%. Just to put some context on it. Once it gets to third stage, half people die. Most people do not get that far. Most people get treatment in time. You know, a good round of antibiotics, some breathing treatments, a few drugs, days in the hospital for observation, you'll be fine. But naturally, since this sounds like such an awful, terrible disease, it is contraindicated, in fact, and you do not want it in your place of business. It is very contagious, so do not mess around with TB. It is a public health risk because it is so contagious. It is airborne. It will hang out for a while after the person leaves. So lots of people can walk through this room and then carry it home and spread it to their kids. It is a huge, huge thing. Tuberculosis is like kick them out of your building. Do not let them in. They need to be working with a healthcare provider. They need to go to the hospital. They need lots and lots of Western medicine. They need antibiotics and drugs and breathing monitors and lots of doctors. So, and then just to be clear, the image that you were looking at, that's not a human. That is bovine tuberculosis. so the kind that you get in pigs, or you find in pigs, which has contaminated a deer. And that's what you're seeing, is the bovine tuberculosis on a deer. And that is going to be the interior side of their rib cage, so the inner portion of the rib cage. Yeah, and it is just as nasty as it looks, guys. And those things form all over the place, and they cause all kinds of problems, disrupting functions, especially if they get in the nervous system. All right, on a lighter note, asthma, probably one of the most commonly recognized respiratory diseases. It is marked by spasms of the bronchi. So the bronchi just cinch closed, and it suddenly becomes very difficult to breathe. Usually the cause of asthma is an allergic reaction, or it could be some other type of hypersensitivity. But again, when we say hypersensitivity, we're still talking about autoimmune. We're still in the autoimmune allergy family. During an asthma attack, massage is contraindicated. There's really not much you can do when a person is having trouble breathing. So in between asthma attacks is fine, but if they're having an asthma attack, either they will need to kind of learn on their own to regulate their breathing and calm down, or if it's severe, they need an inhaler. Like, that's why they have to carry their inhalers everywhere with them. Albuterol was the most famous one. There are lots and lots of different inhalant drugs now that they can use for asthma. So again, there's really nothing that massage therapists can do for asthma itself, like during an attack, but asthma leads to a lot of coughing, and it leads to a lot of chest tightness. So we would focus on the muscles of breathing and the accessory muscles of breathing, and make sure that those muscles are stretched and loosened up, and they're maintaining proper tone, and they're not developing tension. So key muscles you would think at, obviously diaphragm. When you think of muscles of breathing, diaphragm's number one, but also intercostals. Intercostal muscles raise and lower the rib cage during breathing. You're also looking at scalene muscles. The scalenes on the neck that insert on the first and second ribs also assist with rib elevation during forced inhalation. So for forced inhalation, think about staying underwater for just a little too long, and you're starting to get a little panicky, and then when you finally break above the water, you go, and those scalenes lift up on the ribs. That is forced inhalation. Serratus muscles as well. Your serratus posterior muscles. Are you familiar with serratus posterior, superior? Cool. That muscle also helps. And serratus anterior, of course, serratus anterior. All right. Emphysema. Emphysema is one of the conditions that comprises COPD. COPD, or chronic obstructive pulmonary disease, is a big name for a lot of smaller diseases, all of which obstruct the ability to breathe. Emphysema is a chronic disease. So you don't catch it, you don't just develop it overnight. Emphysema develops over several years. It is gradual damage of the lung tissue, specifically the destruction of the alveoli. And I'm going to jump around my slideshow for just a moment. Back here. So we said that the inside of those alveoli, we see each of those little walls has a little hole in it, so that all those little chambers are connected. Those are the structures that get destroyed with emphysema and with COPD. So as the little walls that separate the alveoli start to erode, instead of being left with dozens of tiny air sacs, you are left with something like one large air sac. And guys, I want to be really clear about the name of the game inside the lungs. The name of the game is surface area. It is surface area the lungs are capitalizing on. All those blood vessels laid over top, that's why they bubble out, so we can fit more in a smaller amount of space. So all those little clustered air sacs are packing insane amounts of surface area. For reference, just to give you a clue, if you were to take all of those air sacs and roll them out and lay them out flat so that you were to get the entire surface area of a lung laid flat on the ground, each lung would be about 2 tennis courts. 2 tennis courts of flat space that is all rolled and wrinkled up per lung. Okay, so now when I say the name of the game is surface area, and then we destroy the lining between the alveoli so that instead of having 2 tennis courts, you end up with 1.5 or 1 tennis court. That's not enough. That is not enough. Not enough surface area, not enough gas exchange is occurring. Keep in mind also, guys, when I was explaining breathing, remember I said we start with oxygen and carbon dioxide, and they exchange until they're about level, which means half that oxygen that we breathed in, we didn't even use. We didn't even use half that air. It was pulled in and then breathed out. So of the half of the air that we actually are using, now we talk about diminished lung capacity with COPD. You understand how the situation gets very dire very quickly when lung tissue starts to get destroyed. Yes, we're seeing how this goes. Yeah, cool. Any questions? Nope. Okie dokie.
Is it reversible? Can you regenerate it at all? No.
Not usually in time. By the time it gets bad, no. The best way to, I don't want to say cure, but I guess fix emphysema is not to develop emphysema. And emphysema is caused by smoking.
What about asthma? Does it cause, because I know it can cause like scar tissue in the lungs. Can it lead to emphysema and COPD and whatnot?
Yep. Yeah, remember, COPD is not just the, it's not just the emphysema. Emphysema is just one, yeah, it's one of the many diseases that falls into COPD. But yes, the constant coughing will cause scar tissue to develop in the lungs. Because the lungs aren't as healthy due to smoking, they are more prone to infection, and repeated infections also damages and scars the lungs.
I was born with respiratory distress syndrome. So I've been predisposed most of my life. And I have a lot of scar tissue built up in my lungs from asthma and whatnot over the pneumonia. Mm-hmm. So I was just curious. I probably have a predisposition to emphysema then.
If your lungs are healthy and they're working properly now, then I would be hopeful that you would not develop emphysema. Emphysema is usually, you have to say usually and tends to, because when you use words like always and never, you're always going to get yourself in trouble. You always get in trouble when you say always or never. But the fact is, the vast majority of emphysema cases are caused by smoking or aggravated by smoking. It is very uncommon that someone develops emphysema all by itself. I just whoop, emphysema. No, they smoked.
Okay, thanks.
Yeah. Now, with conditions like yours, I'm not saying COPD is off the table. There are the asthma and the scarring that's already present in the lungs. Those could lead to issues. But
it's definitely in my family, so I've been aware of it for a while, but it's still scary.
Yeah. Well, smoking runs in my family, and unfortunately I've had a lot of my family members come down with lung cancer and emphysema and all that stuff. So it got me to quit smoking though. There you go. So if a client has emphysema, the alveoli, as we've discussed, the alveoli are being destroyed. So early in the disease, massage is going to be fine. But as the disease progresses and their lung capacity diminishes, they are slowly not getting oxygen like they're supposed to. If they start developing heart symptoms, they are contraindicated. Massage can be helpful to reduce tension. We could even do trigger point work for breathing muscles and stuff like that. But once emphysema reaches a critical point and the heart becomes involved, there's really not much that massage will be able to do. If it's advanced, circulatory massage is also contraindicated. And the client, because they have such difficulty breathing, lying down will not be comfortable for them, either face down or face up. Either way, it's too much pressure on the chest and they already can't breathe. So you add a little bit of extra pressure on the chest and they really can't breathe. Seated massage or side lying may be your only options. But again, emphysema people, it's usually going to be contraindicated. All right. Good stuff so far, guys? Good stuff so far. All right. Next up is chronic bronchitis. So chronic bronchitis is just like bronchitis, right? Acute bronchitis, except we said acute bronchitis is usually viral. It's usually an infection. Chronic bronchitis is more common among smokers. People with chronic bronchitis tend to get lung infections very easily. They also have episodes of acute bronchitis when symptoms get worse, but those tend to come and go in spells. So they'll come and they'll get better. Massage is indicated if they don't have any other acute infection. So again, no fever, no chills, no pus, nothing like that. They should be fine. And as long as the client has a strong circulatory system. Once the circulatory system becomes compromised, they are no longer indicated. They are contraindicated for massage. They may need some special positioning. So as with any kind of respiratory illness, just have lots of pillows and bolsters available. You may have to get creative and kind of jimmy them into positions that they can be comfortable in and still breathe. You may need to elevate their head or put them side lying instead of laying prone. And tapotement is indicated. If you catch people with bronchitis, you can help kind of get some of that sputum out of there using tapotement. I think that really wrapped up on that one. Okay. Cystic fibrosis. I know this one looks pretty gnarly, but cystic fibrosis is a really gnarly disease. It is an inherited disorder. It is a defect in a gene which codes for the way that certain cells produce secretions. So cells that secrete things like mucus, sweat, digestive juices, all of the cells that are doing the secretions, they have a mutation in one of their one of the proteins in that fluid, which makes the fluid very thick and sticky. So the fluid starts to plug up tubes, which you can imagine starts to get really bad when you're talking about like lung tubes, like breathing in your lungs, or kidneys or liver, little places like that. So cystic fibrosis usually starts in the lungs. It's usually where you start to see the symptoms. The kid has trouble breathing, and that's usually what takes them into the doctor's office. It's very often diagnosed in childhood. Very often it is deadly, not because of the cystic fibrosis, but because of the secondary diseases. It's usually something like pneumonia or some other secondary infection. Massage can be beneficial. Again, you're looking at digestive issues as well, like digestive juices as well. So we could focus on abdominal massage to help get the intestinal motility moving along. We also promote just general relaxation, and that, being relaxed helps almost everything. The body can't really truly heal until it's in parasympathetic mode. It doesn't really do a lot of healing in fight or flight mode. So relaxation always helps recovery from just about any ailment. And it helps to move phlegm along. The phlegm in their lungs is thicker and stickier than it should be. So you really might consider, the positional system where you dangle them upside down and shake them really hard. No, I'm kidding. but you angle them upside down and you push the fluid out of their lungs. That postural drainage is often one of the key factors in the survival rate of cystic fibrosis. Most people with cystic fibrosis used to die in childhood from the disease. Nowadays, the common life expectancy is at least 30 years. And we're diagnosing more and more adults with cystic fibrosis with what they're calling atypical cystic fibrosis. So, sorry, I was just catching up on the chat. I just now saw all the chat. Doc Holiday, that must have been when I was talking about Westerns. Yeah. All right, how about a break, you guys? It's about that time. It's about that time. We'll take 10 minutes and I'll see you right back here. All right, we are back. So we left off talking about cystic fibrosis. Does anybody have any questions over anything that we have covered so far this evening? Okie dokie. So the common cold, influenza, and pneumonia are all types of which infection?
Bacterial.
Can't hear you.
Viral.
Viral. Which of these is a highly infectious airborne disease that begins in the lungs and spreads through the body?
Pneumonia.
Influenza.
Tuberculosis.
Thank you. Tubercles
strep.
in the brain and in the spine, and yeah, tuberculosis. Tuberculosis. Influenza is highly infectious and airborne, but it's a respiratory infection. It stays in the respiratory system. Pneumonia is fluid in the lungs, also an infection, but pneumonia stays in the lungs. Tuberculosis travels all over the body. Which of these are comprised of spongy tissue, blood vessels, connective tissue, and alveoli?
The lungs.
The lung. Microscopic air sacs.
Alveoli.
Alveoli.
Alveoli. Without a constant supply of oxygen, a human being will die within a matter of
Seconds.
Minutes.
minutes. The need for oxygen is the most pressing need of the body. You can go weeks without food. I know it may not feel like it, but you can go weeks without food. You can go days without water. You can only go for about 10 minutes without oxygen. With training, 10 minutes. But most people, 4, 5.
That's like a
Guys-
Navy SEAL thing.
Yeah, I was gonna say that guy just set a record, one of those like magician type dudes who was like chained up in a water tank for a record amount of time. And he was in there for like 20 minutes or something like that. But like, believe me, you and I could not do that. I don't think I would make it 3 minutes. The common cold, or a URTI, that is upper respiratory tract infection, is a common bacterial infection spread through physical contact. True or false?
True.
True.
Okay. By
Well,
show of hands, who says true? By show of hands, who says
You mean
false?
physical contact with another person versus physical contact
What I said,
touching?
physical contact. That is false. The common cold is a virus, not a bacteria. I see you, Bree. Brianna's like, yep,
Trick
I
question.
told you guys. It's not a trick question, you guys. You need to know which of these are viral and which of these are bacterial. That is part of my point here. The common cold, influenza, those are viruses.
Yeah, the trick
Tuberculosis,
is paying attention to the
the
wording.
bacteria. Yeah. Percussive massage has proven helpful once the client has reached the subacute stage of which condition?
Pneumonia.
Pneumonia.
Very good. Very good.
Bacterial.
Bacterial. Bonus points. Does anyone remember the name of the bacteria? I put it in the slideshow. If not, it's fine. That's why it's a bonus point. It's no big deal.
It's myobacterium.
That's the one. The name of the bacteria, like its scientific name, is Mycobacterium tuberculosis. That is its genus and species name. That's its name. Mycobacterium tuberculosis. Carbon dioxide is carried to the lungs by which of these?
Red blood cells.
Red blood cells. There we go, guys. That's respiratory. Not a whole lot. But to be fair, even at my last school, respiratory diseases, there was not a lot. So. Side note, this slideshow here that you're looking at is one that I made recently. So I will get the slideshow put on Moodle. The ones that are already on Moodle were not, I inherited those. So I'm gonna put the one that I made on there.
Yeah, I noticed you put a lot more information into yours.
I try. I really try. Also, I realized I didn't realize I was a few weeks behind uploading our pathology lectures, our recorded Zoom lectures, and I record them. So I sat down last night and just like became like a YouTube sensation. I uploaded like a bunch of videos last night. So they're up to date. We are up to date. So tonight when the recording is done, I will get it posted up. Recorded lectures are on Moodle, up to date. And yeah, that's all I have. That's everything. No more questions? Going twice. Okay, you guys have a good evening. I'll see you next week.
Thanks, Dave.
Thank you.
Yeah, I hope everybody got registered for all the classes that they wanted. Except for the record keeping class, because that thing filled up in like 30 minutes. That thing was full. All right, have a good night, everybody.
You too?
Thank you.